Neurodevelopment disorders include a wide range of conditions such as autism, cerebral palsy, attention deficit or hyperactivity disorder, intellectual disability, development delays, vision and hearing impairments, among others. These conditions can profoundly impact the abilities of affected children to communicate, learn, and engage in social interactions. However, there is an extreme lack of access to specialist facilities and personnel for these children in the Upper East region and generally in northern Ghana. To help parents and caregivers of children with these special needs to be better equipped to provide the needed care for them, a medical outreach was organized at Bolgatanga here in the Upper East region. The outreach was hosted by Professor Mahmudu Akudugu and his wife, Catherine Miller, who are both lecturers at the University for Development Studies.
The whole of the northern sector, the 5 northern regions, we have only one speech therapist, speech and language therapist based in the Tamale Teaching Hospital, who is serving all the 5 northern regions. For neuropediatricians, we don't even talk about that. And so we thought that to fill that gap, we needed to think out of the box to bring these specialists closer to the people. In fact, those that we brought from Accra, they have some clients here. They have patients here who have to travel all the way to Accra to see them.
And with issues of neurodevelopmental conditions, it takes a society. It's not only up to the parents or the caregiver. It takes the whole neighborhood, because people need to understand that, like autism, it's not sickness. The child is just, let me say, is wired in a different way. So first of all, you have to understand the child. And these children need to be loved.
The medical outreach was supported by the Mela Open University, Mission Pediatrics, Clicks Africa Foundation, and Rise Ghana. Specialist consultations were given to parents of children with these special needs at the outreach. Speaking later to Joy News, some of the parents bemoaned the lack of insurance coverage for the children's medications. Many of these parents are without any regular source of income and therefore struggle to afford these crucial treatments for their children. They are therefore appealing to the government for neurodevelopment disorder medications to be covered under the National Health Insurance Scheme.
We know it is not all the conditions that demand medication, but those that demand. Some medications are supposed to even be imported. I personally took loans to import some of these medications, and they are supposed to be on the medication for a very long time, and you can imagine.
And it involves a lot of scans. There were 3 scans that were conducted on my child. At that time, I paid 500 for the CT scan. Drugs that they wrote for us to go and buy wasn't small amount. It was not easy for me and my husband, because I just completed college and I'm not employed. My husband, who is a businessman, lost everything because all the business money was invested. We had a lot of properties, we sold them.
I tried TTH. I went there. They queued to see the specialist, every child with his special needs. But he was a doctor who sees all other special children. So you need to book ahead of time. Government hospitals, but none of the medications is given in the hospital. When they write, you would have to go and buy. And because of this, you would have to go to Accra to see those private hospitals at your own cost. The medication of these special children should be captured in the health insurance, should be part of health insurance. And then the region can sponsor for the region to have at least one speech therapist, one occupational therapist.
Upper East Regional Minister Stephen Yakubu said government will help address issues affecting children with special needs and their parents.
I think it's very key and it's very important for us to be able to get this medication onto the National Health Insurance Scheme so that it will bring a bit of relief to our mothers. We are working assiduously, we are working so hard to get special doctors into this region. In doing so, we are planning and working very hard to get this hospital to be a teaching hospital.
For Joy News, Albert Sorry, Bolgatanga.